Imagine you wake up one morning with sharp chest pain. You are terrified, but then you remember that you have good health insurance. Now imagine if you had no health insurance or minimal coverage. Do you risk going to the doctor and struggling to pay medical bills, or do you ignore the pain? That is why today I will be discussing the pros and cons of universal healthcare. As a nursing student, I have read multiple sources to ensure that I am conveying both sides equally. Due to this topic being an important debate in our country, it is important for us American citizens to fully understand both sides of the argument to form our opinion. In this speech, I will thoroughly explain the benefits of universal healthcare along with the disadvantages. Providing universal healthcare would benefit the population of those who are uninsured in America. Universal healthcare is a system that would provide services to all American citizens. According to the Commonwealth Fund's 2024 Biennial Health Insurance Survey, 26 million Americans are uninsured. This has gone down significantly since former President Obama signed the Affordable Care Act in 2010. Gabriel Zeff, Zachary Kerr, Justin Moore, and Lee Stoner of University of North Carolina at Chapel Hill state that the most beneficial advantage of universal healthcare would be the potential to address the epidemic level of non-communicable chronic diseases. These diseases are very common and include cardiovascular disease, type 2 diabetes, and obesity. Universal healthcare would also improve the economy of the United States. Researchers from the Yale School of Public Health found that a universal healthcare system could lead to a 13% savings in national healthcare expenditure, which is equivalent to $637 billion annually. Gabriel Zeff, Zachary Kerr, Justin Moore, and Lee Stoner of University of North Carolina at Chapel Hill state in their article that those of lower socioeconomic status have little to no resources to pay bills caused by health issues and a lack of insurance. With the influx of citizens that are either underinsured or uninsured, they believe that the use of a universal healthcare system will prevent the economic influence that is occurring. Although a lot of positives may occur due to universal healthcare, it is time to discuss how universal healthcare can negatively impact the United States. Universal healthcare would raise the cost for taxpayers and make it harder to see a doctor. A universal healthcare system would have to be funded through the taxes of middle to upper class Americans. The Committee for a Responsible Federal Budget states that there is simply not enough available revenue from higher earners and businesses to cover the complete costs of a universal healthcare system, which means people like you would be getting charged higher taxes to fund this system. And a proposal for universal healthcare by Senator Bernie Sanders included options for funding such as a 7.5% payroll tax and 4% income tax on every American. This would really affect those that have a higher income than those who have lower income. Universal healthcare would increase the wait times to receive basic care, ultimately leading to worse health. According to the Congressional Budget Office, universal healthcare would lead to an increased demand for care, which would then cause increased wait times and potentially the need to travel to see a doctor. We see this happening in Canada, where there is universal healthcare. In 2017, a study was conducted, and Canadians were on waiting lists for an estimated 1,040,791 procedures. In the UK, where universal healthcare is used as well, it takes 46 days to receive hospital-based care. The negative impact of universal healthcare needs to be equally considered along with the positive impacts as well. In total, universal healthcare has many pros and cons. It could benefit those who are severely underinsured or uninsured altogether. But it could also affect the entire healthcare system as we know it. I hope that the information given today was helpful in your understanding of both the positive and negative impacts of universal health care. Again, all of the sources I used when crediting this speech are reliable and credible. I encourage you all to take what you have heard today into consideration and base your opinion of universal health care on factual information. Perhaps most of you don't have to worry about being insured right now, but eventually you will, and this debate will one day become more relevant to you. Thank you.